My name is Shelby Silvan. I am in Nursing 304, Healthcare Informatics. For the Healthcare Informatics in Nursing Education presentation assignment, I will be conducting a presentation on promoting active and collaborative learning. Promoting an active and collaborative learning environment within nursing education will expand educational outcomes for the nursing profession. This framework of learning promotes teamwork, interactive lesson plans, student involvement, peer support, and critical thinking that is enhanced with the utilization of technology. Technology promotes active and collaborative learning by encouraging interactive learning, accessibility to evidence-based practices, nursing informatics and clinical practices, and hands-on simulations. Technology is also flexible in how, when, and by who it can be accessed by. The authors of Digital Collaborative Learning and Nursing Education, a systematic review, express that knowledge within nursing can be expanded through informatics. The authors believe that nursing informatics requires social, administrative, technological, and pedagogical competencies. And by obtaining these competencies, it will enhance a nurse's self-driven problem-solving skills, motivation, and direction. The authors claim collaborative learning and digital learning environments has encouraging effects in enhancing nursing students' knowledge, competence, satisfaction, and problem-solving skills. Sonique Salesman, the author of Utilizing Online Collaborative Technology to Promote Active Learning in Nursing Students, encourages students to engage in online lectures. Salesman identifies the need to use creative teaching techniques through online tools like Zoom and Google Docs in order to increase student involvement within the learning process. The author encourages teachers to come to class prepared, encourage peer-to-peer interactions, and enhance learning by teaching in a way that students can comprehend and absorb. Active and collaborative learning strategies has the capability to expand nursing education for the better. Knowledge retention can be increased in nursing students when utilizing hands-on learning techniques that help maintain focus and engagement. Students can have increased psychosocial outcomes when mutual support is encouraged. This can lead to a decrease in nursing burnout by installing healthy coping strategies that can be used throughout their career. This framework of learning teaches teamwork, accountability, and leadership skills through collaboration. Utilizing technology to promote improvements in nursing skills can be accomplished through interactive scenarios. These scenarios promote teamwork, critical thinking, and performance feedback. Using a team approach to learning nursing skills will enhance student outcomes by decreasing anxiety and learning from one another's performances. Implementing active and collaborative learning into nursing curriculums can improve student outcomes. One important implication needed to integrate this learning technique into a lesson plan is to identify the goal of the activity and give specific detailed instructions on how to obtain it. Some ways this can be performed is by clarifying the role of each team member and by identifying the expectations of these roles. Technology can be utilized to enhance collaboration between students. Activities such as interactive scenarios on mannequins, games that utilize subjects being taught, and team presentations through PowerPoints are a few examples on how technology can be integrated into interactive learning. While students perform these tasks, they have been instructed to perform. Instructors can provide guidance and support while also identifying the strengths and weaknesses of each team member. Understanding the students' room for improvements can enhance the effectiveness of future learning goals. It is also important to create a therapeutic learning environment to allow students to ask questions and also give feedback. Implementing these strategies will enhance the outcomes of the activities and collaborative learning strategies. There are both advantages and disadvantages to integrating collaborative and active learning into the nursing lesson plans. Advantages of this learning strategy includes the promotion of accountability, increased engagement levels, peer discussions that promote clarification of topics, instructors being able to identify areas for improvement, the promotion of critical thinking, teaching team dynamics in a professional environment, and the enhancement of knowledge retention. Disadvantages of this learning strategy includes an increased preparation time for instructors, the risk of unclear instructions leading to non-beneficial learning, the risk of a team member negatively affecting the team's learning experience through the lack of motivation or by increasing disagreements, and technology malfunctions as well as educational requirements to learning the technology are also a disadvantage. While there are disadvantages in incorporating active and collaborative learning in nursing education, the benefits of this outweigh the disadvantages. It is essential that nursing instructors and nursing students identify what their self-perceived disadvantages are. By identifying their disadvantages, they will be able to modify the way that they incorporate the learning strategy into their nursing education. There are many buy-ins for promoting active and collaborative learning in nursing education. Nursing students are able to utilize the knowledge learned through their educational experiences and clinical practices once they graduate. This learning strategy helps nursing students graduate with retained knowledge of clinical processes, optimal nursing skills, the ability to partake in team roles, the ability to incorporate nursing informatics into nursing practices, advanced critical thinking abilities, as well as increased self-confidence in their nursing abilities. The challenges that instructors and students face when incorporating active and collaborative learning in nursing education can be overcome through the intentional implications. Students may face the challenge of learning in a new way than they are familiar with. Instructors must make the lesson plan cohesive to old learning strategies. For example, the instructor can still teach from a PowerPoint like they have in the past, but also incorporate a group activity that promotes relearning the material that has been taught. Nursing programs will be faced with the challenge of obtaining up-to-date technologies in order to promote a collaborative experience. To overcome this challenge, budgets for this technology as well as education for this new technology can be created. Adjusting to being involved in the learning process can be a challenge for students. Instructors can promote a supportive environment through feedback and teamwork, as well as include specific expectations of the activity's outcomes by giving them team member roles and by clearly identifying a mutual goal. Planning for these active and collaborative learning opportunities can be a challenge for the instructors. By collaborating with other instructors and incorporating planning periods into their schedules, nursing instructors can overcome this challenge. With the ultimate benefit of collaborative and active learning being better outcomes for nursing students, it is essential to overcome all challenges in order to create a positive change in nursing education. The references utilized in the creation of this presentation are listed on this slide.